Hello everyone, welcome to this fourth Inclusion Full Circle Dialogue. Today we have a special guest with us and she is quite an expert in her field. So I welcome Dr. Neha Tiwari to this fourth circle. Welcome ma'am and thank you so much for accepting the request. Thank you so much for being here.
Thank you, Nidhi. Thanks to you for extending the invite. And it is a topic very close to my heart. So there's no way I could say no.
Yes. So I've just opened up with her name, and I would like, ma'am, you to come up with your own description because I will be short of words when describing your work. So please introduce yourself. How do you see yourself as a person, as a profession, or who is Dr. Neha Tiwari?
Uh, I am a person working in field of rehabilitation from last 24 years. And I'm an awareness evangelist, somebody who loves to work on ground with people,
Mhm.
somebody who tries to connect, you know, to all the stakeholders. So all of us are working, for development of children and individuals, not children only, individuals. So I'm also working in the same direction, but my forte has been, children, early identification, early intervention, awareness, community building, and empowerment.
That's quite a great work, ma'am, which you are doing, and that too since long. 24 years are not a small journey, actually.
I have
Thank
just
you for
started.
doing that.
I
So let's open our circle of questions. My first question to you is that you have spent over 2 decades helping children to communicate. Today, what do you think people still misunderstand when it comes to the communication?
I think biggest misunderstanding is communication equals speech. So I think that's the biggest understanding. So when parents come to me, they say, "Ma'am, we want the child to speak." Uh, and that's the first thing I try to counsel, parents understand their point of view and then tell mine and then, come to common ground. So speech is only one way of communicating. Communication is about interaction. It's about connection. So it's much more than speech. And a child who speaks fluently may still struggle to communicate. If he or she doesn't have social, he doesn't understand social situation, or he doesn't know how to regulate emotions or engage meaningfully with others. Similarly, a child who is not, he's just using gestures or probably alternative or an augmentative communication device, probably is communicating beautifully. So, as SLP, our responsibility isn't simply to teach children; it's to help every child find a voice that works for them. So,
That's so beautiful, ma'am. That's so beautiful. Next question is, are we producing children who can speak or children who can actually communicate?
uh, as I said, I think it's one question that we should be asking as educator, as therapist. We should ask ourselves also. What are we focusing on? So sometimes we become so focused on language milestones that we forget the whole purpose of language. So communication isn't only about making perfect sentences. It's
Mhm.
about participation, being engaged in society, social interaction. So we should ask ourselves this question: can the child express discomfort? Can the child advocate for self? Can the child make friends? Can the child say no confidently? These are the communication outcomes. So, definitely, we should be, as SLP, my aim is to have children who can communicate, uh, not just speak.
Okay, and how much do you think that decision can be influenced by the parents' perspective also?
Uh,
Because in
yes.
my experience, I have come across parents who are very particular that no, ma'am, we want them just to speak. You just focus on that.
All right. See, I have experienced that too, Nidhi. But in my experience, I feel when the beginning, the session just shouldn't start off like that. So in my case, what I do is what I have learned works with children and parents is engage parents from the very beginning, engage them in the session, and
Mhm.
they must understand that even without using words, child is here in the interaction setting. He is interacting, he is participating, he's here, he's not in his own world, he's not lost. And out of 10, I would say 6 parents understand, and they themselves tell me, okay, ma'am, I think this is working. Let's start with this. One more thing, Nidhi, is that when I tell parents till the age of 1 year, when the child is not yet started to pick up words, what is he or she doing? It's gestures, it's pointing, it's body language, isn't it? So let's begin with that. Let's see how it works, and then
Mhm.
we'll see. So I take parents' perspectives. Definitely, it's important because I must know their expectation, and
Right.
based on that, try and because it's not only about setting expectation, it's also about shifting expectation. So in
Yeah.
therapy, the role of therapist is not to just prepare goal. I think it should be a very collective decision as to, okay, this was the previous expectation. We have shifted through counseling, through discussion, being on the common grounds, and you've shifted the expectations. Probably short term only. So
Yeah.
I feel parents' involvement is very, very important because they help us make our child better, this child better.
Mhm. Right. Why do so many children make progress in therapies, but still they struggle to generalize those skills in a classroom or in a home setup?
So true. Yeah, it happens, because learning doesn't automatically transfer from therapy to classroom. See, therapy room is a very structured, very supportive, very predictable kind of, four wall ke andar one setup.
Right.
Classroom is dynamic. It shifts. It's unpredictable sometimes. There are peers, and then you have pressure, you have expectations. A routine may change. So the generalization happens only when what I know, the parent knows, what I know, the teacher knows, what I know, the co-teacher knows. So when we all know the same thing, we are on the same ground, we work together, that's when generalization happens, and it can happen successfully. I have been doing it with the help of parents, not alone, definitely, but we have been doing it. So
Right.
that's why I spend a lot of time working inside schools, talking to teachers, taking counselors' help, taking special ed's help. So be working in team is important. So if they
Mm-hmm.
struggle to generalize, I think there's a need for us to not to come out of our clinic and work more in the school setups and help that generalization happen.
And I think it's one of the aspect that others apart from speech therapists need to understand is that in a therapy setup sometimes we make the environment such a way just to facilitate that learning should happen in this way, but
Yeah.
that cannot be the case everywhere apart from a clinic. So for to generalize the learning apart from a setup, child needs to practice it in a multiple situation with different
Multiple
people.
situation, exactly. And it's not only with the developmental disorders. Or it could be, other types of disorders also, wherein we say,
Even
okay, the
with the
child is speaking fluently here in the clinic. Is he or she speaking fluently, talking to strangers? How do I know that? So I will have to expose the child. And that's when I understand, okay, this is where the maintenance of the behavior is happening. The generalization is happening. So, yes, so true.
it's very like quite simple if we even if we see the neurotypical children and when they start learning their process with the words or alphabets, we provide them quite a lot repetitions so that they can memorize and understand and carry over
Exactly.
wherever they go.
Exactly.
Okay, that's a quite subtle learning. I think everyone needs to understand that.
It's yes, we should be learning. We SLPs should learn to come out of our comfort zone inside a clinic and work out. I'm not saying just leave clinic. I'm saying ensure generalization.
Right, right.
Yes.
Have we confused inclusion with accommodation?
Um, yes, sometimes. Sometimes, especially when we are talking about, these terms could be new to many schools. So
Mm-hmm.
even if the schools who the teachers who know these, they still could be confused. Accommodation is very important. Like if you're providing extra time, or you are providing visual support, or you are talking about the alternative seating. So what you can do in the environment, right? Or these things matter. But
Mm-hmm.
inclusion goes much, much deeper. Uh, Accommodation changes what we provide. Inclusion changes how we think. So, inclusion means every child belongs before they perform. So, that belongingness is inclusion. After the child comes to the environment, now what can I do? What changes I can make in the environment, and or the resources or the teaching material that could suit the child's needs, in every child's needs. So there is confusion. I think teachers must know it. Inclusion comes first. Accommodation
Right.
is just a part of it. Inclusion starts here.
Yes, actually, for most of us, it is a taboo that, oh, we need to get some kind of certification to start with the inclusion. But the very basic thing, they can start inclusion in their mind at least first. Because
Yes.
without it begins here, no amount of training can help them.
See, in I think teachers, they know it. They When you have, suppose there's a classroom and there is no there is you have neurotypical children.
Mhm.
If I stand in front of the classroom, I know inclusion is still happening there, because not every child, not two children are same. Teacher
Right,
is taking care of those who are visual learners, or who are auditory learners, or kinesthetic learners, right?
right,
So yes, so it just a shift in the way you think. It's nothing new. In concept of inclusion is nothing new. Nidhi, I think just making it special in terms of children with special needs, I think we have created, an aura to it that scares a few people. That kind of make a few people uncomfortable, saying, "Oh, we can't do it. Oh, it's so difficult." No, we have been doing it.
it's just a new perspective how you are considering now.
Yes, exactly, exactly.
I hope this statement helped most
And
of us
that's
to
how
improve.
I always say that to the teachers. I don't a simple example I'll give you. Like, I have two children now. One likes rajma, the other one doesn't like rajma. So what I'll do, I prepare rajma. I also prepare something that suits the other child's need. I am including the child. So, and why don't I have the same perspective when it comes to, in a classroom where I have a child, a neurotypical, and the other one probably not, probably on the spectrum, or some other disability. So that's, like, oh my God, now what to do? Just understand the child needs and serve. That's it.
Yes, yes.
That's it.
Next is, are schools asking therapists to fix the children instead of redesigning and facilitating a learning environment according to their needs?
Yes, I think sometimes those expectations exist, and but over a period of time, Nidhi, I've realized the schools have been changing, the perspective has been changing. So now Sometimes I feel it's very encouraging actually to see schools redesigning learning environment first, then
Okay.
asking therapists to to help children. So when a child struggles, our first question shouldn't be what's wrong with the child. Our first
Mm-hmm.
question should be what barriers exist in the environment. Can How can I make the our instructions suitable for everyone? How can the transition be predictable, or how can peers become partners? So children, they shouldn't be the one carrying the burden for fitting into the system. The system has responsibility to fit that child, I feel.
That's quite simple, and I most of the time I correlate this with analogy of a plant. Like we don't fix the plant to survive in an environment, we fix the environment so that a
Exactly, so
plant
true.
can
A
flourish.
beautiful analogy. I'm going to use that. Thanks.
Thanks. Okay, so next one is we screen children as we advocate towards early identification, early intervention. We start with the screening. But now the question is, and we are considering that schools should fix the environment or redesign the environment, then who is supposed to screen those environment?
So, see, first of all, I love this question because this is what we have been doing, screening children. So we routinely, our foundation routinely assess children's speech, language, learning, behavior, needs. Even in our clinics, we do that, right? But who should be screening? I would get back to people who are the part of ground force. So, understanding, is my classroom communication friendly? Is the school environment, friendly? The infra is friendly, the infrastructure. Are teachers trained? Do we have the visual support in the classroom? Are children emotionally safe? So these questions who should be asking? The school authority and the stakeholders. And how could they ask such a question when they have knowledge? And that's where I feel the awareness creation and awareness building, and that
Mm-hmm.
thereby building the whole community that looks at through the same lens. So we will screen children, but the screening environment process will be taken up by those who are empowered. So we have to do that.
Again, I think it's back to your point, inclusion starts here. So, in at least in their capacity right now, they can start questioning, is it including everyone, is it communication making
Yeah.
easy? At least they can start with the questions as of now.
Yes, Nidhi, and the questions will begin when there is a curiosity to learn about this. And like I always thought, I mean, it's a very wide perspective, you could say. In general, in life, all the complicated things are actually very simple. Or you could say the solution to all complicated problems are very simple, based on very simple facts. Here also, when it in the context of what we are discussing, I think it's very simple.
Mm-hmm.
Just gather people, whichever ground you're standing on, make them stand on the same ground.
Right.
It should not be knowledge should not be centered in one person's hand. What I know, teacher must know. What I know, parent must know. In fact, the parent must know more and ask question. So that's very simple, and that's how it should be done, I think, and it's been working in my case at least.
Does every child diagnosed with autism needs oral placement therapy, or how do you decide when it is appropriate?
No, 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 not every, absolutely not. No single therapy fits, every child on the spectrum. See, OPT has a role, and but it's only when you do assessment, and you feel that it's indicating specific oral motor or any feeding challenge that. So as clinicians, we should never select therapy because it is a popular therapy. It's trending. So in clinical
That's what
practice,
the
be very
concern.
careful. Be very careful. It's trending. I see, people just giving OPD tools. Keep must you must and selling them in the clinics. Please use them. In at home. Child may not be needing any expensive tools. So please select therapy because the child needs it, not because the administration of the clinic needs it. And remember, use evidence based practice. So when you say I'm using evidence based, I feel I'm combining a few things, something like just scientifically backed, which is you should have a clinical expertise in it. You can't be non-trained, and you could be, you can't do that. So you should be
Right.
certified, and you should also have the family's priorities. So
Mm-hmm.
if you consider a few things, I think you'll do good. So assessment comes before intervention. Do properly, and assessment also includes understanding parents' requirement, needs, financial status.
So many aspects are there
Yes,
actually.
yes, yes.
Because sometimes when you are all set to start with the oral therapy, might be the child is not ready for that exercises. They are not mentally, emotionally cooperating for that. So you need to wait for that too. That's
See, you have the warming up in OPT since I'm OPT level 2 trained. So I know when to begin with the warming up and how to prepare the child. So
yes,
definitely assessment, when you assess which level the child is at, the child needs it or not, and if he needs it, which level,
right.
readiness of the child. I think assessment of every aspect that's needed.
Yes. I think the one concrete message I can repeat for myself and for the other people is that OPT is not for every child.
Oh,
Doesn't matter it is trending or being recommended by how many therapists. If it doesn't require to your child, you don't need to go for that. Right?
exactly. Exactly.
The next in line of trending therapy is ABA. Does every child with autism needs ABA, or are
Again,
there
no.
situations or criteria to start with?
No, 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 no. Again, no. See, it is a very autism, especially ASD, is a it's an incredibly diverse uh, disability. So, one child may benefit from behavioral strategies, another may primarily only need the sensory integration or sensory regulation. So, the other may require AAC. So I feel, or probably in my, like most of the times in my case, I start with parent coaching. So the question shouldn't be what therapy does this diagnosis need? No, this is not the question. The question should be what does this child need? So don't give therapy based on labels. Give therapy based on the children's needs. That's simple.
That's a quite subtle yet powerful shift. If we are able to ask the correct question, then only we can produce the correct solution to it.
Exactly.
That's why I kept on saying rather than going plainly with the diagnosis or the scores, have a look at the child, have your own observations because autism is just a one plain label. Besides, every child has a different needs even with the same level.
Very good. Yes, exactly.
We often hear early intervention is better. How do we ensure that it doesn't become rushed or one size fit all?
See, early intervention is valuable because brain is developing. But as you said, how do we ensure it doesn't become rushed? So I have seen few people, being in hurry for early intervention. So it shouldn't, early doesn't mean, hurrying things. Families shouldn't feel the pressure that, every hour of the child's, day should be filled with therapy. No, children need to play. They need to interact with, same age group children. They need to rest. They need to build relationship. They need to have feel joy and happiness. Sit idle. sometimes. So the family routines are important. So I feel not therapy sessions only do not make or fix children. Families
Mm-hmm.
do. The normal routine does. Parent training does. And quality matters more than quantity. So we have to ensure that even if the child is not come to therapy, it's all right. The needful is getting done at home based on what therapist and parent have decided. See, as a therapist, when I talk to parents, I always ask them, I'm recommending these, or I'm demonstrating an activity, and I always ask the parents, do you think you'll be able to do it in the at home? And if you
Mm-hmm.
will be able to do for how long? What
Right.
difficulties will you find doing it at home? And
Mm-hmm.
when they say, "Ma'am, we can't do it this way," it's fine. So that's when I have tried and fixed the problem. So
Right.
and children's the days are saved. It shouldn't be that you give and the activities never get done at home because parents have been facing issues that you have never tried to understand.
Right. Right. We are seeing increasing screen or mobile exposure in children under the age of 3. So, what does the evidence tell us about this situation and what are the myths being created around it?
Okay, so see on our Facebook page and also on our YouTube channel, Sacheta Foundation, I have uploaded many videos, related to the question being asked. So, and this is one of the most common concerns we hear from parents today. So, as SLPs are concerned, I feel isn't simply that children are using screens. That's not a concern. Concern is the skills that are getting replaced during while viewing a screen. So what skills are getting replaced, and these skills, how important they are in the early years of communication, for communication development. So we know it's the golden window, no, for brain and language development, the first 3 years.
Right.
And the evidence consistently shows that when screen time becomes excessive, especially now, there are two types of screen time. You have the passive screen time and active screen time. So, when passive viewing is excessive, so that is
Mm-hmm.
associated with speech and language concern, the communication difficulties. You'll feel poorer vocabularies or fewer the mean length of utterances though, or inadequate speech and language development, attention issues, the pre-linguistic skills are deficient. So it's important to know that these are associations. Screen time doesn't automatically cause language delays, but when it replaces meaningful human interaction, that's when children miss valuable learning experiences. And one of the strongest findings in research is that children learn language from people, not from screen. So
Right.
uh, it's important that to you don't oversimplify the issue. Not all screen time is equal. Watching videos alone for long periods is a very different from if a parent is sitting beside a child, parent is talking, discussing what's happening on the screen, asking questions, connecting it with the real, with real life. So when active screen time happens, which is also called co-viewing, or which is also known as joint media engagement. So that makes screen experiences much more interactive, and it contributes to language. And second point was the myths. So the various myths, I'll just tell first common myth that parents generally have is educational videos. You show educational videos, wow, the baby will start talking. So
I was about to come to that point only
yeah, so
because
evidence
here,
doesn't support this. No, no, no.
here I'm
It's,
seeing lot many parents like Ma'am, we were just helping out to learn with the alphabets. We were just
Again, it's a
showing
passive
how.
viewing, right? So passive viewing will not help. So that's definitely a no-no. Another myth is more screen time and autism. So there's a direct link between screens cause autism. So the current scientific evidence does not support that claim. See, there are various biological factors also. However, excessive screen exposure may reduce opportunities, to practice the communication skill. As I said earlier, it's not the screen. The problem is the skills that are getting replaced. That's
Okay.
important. Um, Parents suddenly say, my child, I knows alphabets, he knows colors, he knows blah, blah, blah. So they're learning well. Memorization is important, but memorization does not mean communication. That's another myth. So we have to understand, make children understand language, which is a part of communication.
Mm-hmm.
Language, the rote learning is not language. So
Right.
it's another myth we have to bust. And last I can think of misconception is that if you have television, background television on, it doesn't matter.
Okay.
So, a child, ma'am, the child he plays, he doesn't actually watch. The television is just on. Studies have shown that even when children aren't actively watching, background television reduces parent-child interaction, conversation. Definitely. So if something is on, you may not be watching it all the time, but something interesting comes up, and while you are interacting with the child, the eye contact will break. You look at the screen. Why,
Right.
you may just look at it for a very short time, but the interaction is broken. So
Right.
yes, so that's another misconception I feel that is there. So from my perspective, I feel the goal should not be to make parents feel guilty about every minute of screen use. I think it's important that we encourage balance
Okay.
and we ask parents, if the child is using screen, what is he missing on? Fine, he's gaining something, he's gaining the words, the colors he's learning. What is he missing on? And when these things come out of parents' mouth, they understand it better. Okay.
So you have explained so much, but I am coming up with follow-up questions, and they are like, you talked about that screen should not replace the skills developing and skills learning, right? But there are other aspects like if a 6 months old or a 1 year older child is being exposed to the screen itself, so doesn't it create any impact on their health or their developing brain?
Obviously, I talked about balance here. So when you say 6 months old being exposed to screen, even if it's an active screen viewing, even if it is that, so you have to keep in mind the age of the child, the amount of human interaction, and indirect human interaction. So what's happening is there's a screen, parent is sitting, a child is sitting, and parent is talking to child looking at the screen.
Mm-hmm.
And third is a parent is talking to the child without screen. So in second and third case, you'll find this the communication is happening, but more direct is the third case. So here, you must understand when we counsel parents about screen, we
Right.
must understand what is their definition of screen time first. Second, do they understand the skills that are getting replaced? What's
Mm-hmm.
actually happening at their home? Okay. Fourth
Right.
is how can they strike a balance? So if mother
Mm-hmm.
says, "Ma'am, I'm working, I can't do. What should I do? I have to leave the child in front of the screen. I have no other option." You may provide another option, such as you have suppose a child is very young, so you may provide bright black and white cards, and if you have very simple activities, one can recommend to parents to try and slowly replace screen time with something else. So
Right.
that's my take on it.
Next one is also a very interesting and debatable question. Falling out of spectrum or reversal of autism. How should families understand these claims?
Um, Many people have been claiming like the child has the symptoms have been reversed. So I think families deserve honesty, very honest. And I have seen some children, when detected very early, identified early, the therapies began, and the home training was very good. Parents were empowered, and there was collective vision for the child. Those children have made remarkable progress. Some There are children who no longer need that diagnostic criteria in their life. There are
Right,
some who require support. So I think autism is not a race to become non-autistic. The real question is the child happy? So families must understand, is the child happy? Is he more independent, more functional? Is he using functional communication? Is he socializing better? Is he more included? So these, I feel, are the more meaningful outcomes rather than the reversal of autism, falling out of spectrum.
right, right. Because uh, with lot of parents, when the diagnosis come, I do acknowledge and accept that accepting the diagnosis itself is not a very simple thing. And from
Uh,
that day only, I think the mental race has started that we need to reverse it, we need to fall out of it.
Nidhi, here I'll say something. See, I don't know. I mean, my approach. This is my approach. Uh, I do not label any child for my documentation purpose. Yes, I do, but I
Right,
don't tell this to parent. What I feel is very simple. What I feel is I look at the child's strength, what he likes, dislikes. I look at the deficit areas where the
mm-hmm.
child lacks. Without diagnosis or with diagnosis, we have to work on the deficit areas. Yes or no?
Yeah,
Yes. So I feel, for me, I always tell parents, okay, at the age of 2, these are deficit areas we are seeing, which are very close to, because they will keep hearing it from the environment. Oh, बच्चे को तो ये symptom है, वो symptom है, ये तो बच्चा. I may not tell them, but they will hear. So I tell them these mimic, very identical and close to this. But with therapy, the severity will change, the pattern will change. You'll find the whole picture changing. So
right,
give us some time, especially when the window is like 2.5, 3.5, 4.5. I do not give. I'm openly telling you, I do not give a label.
right, right.
Yes.
And I'm happy to say that I'm on a same page
Okay.
because over the time, after interacting so many children, I've realized that even if they have been gone through a deep and intensive assessment, they just provide in the last they just provide the diagnosis, a one name. They
Yes.
don't give you the whole picture of a child's strength, deficits, challenges, their emotional aspects.
So
They
true.
don't give you the meaningful data which where on which you can build upon. They just give you the rating,
Exactly.
which is okay, which is good for the professional communication, which is good for the further research, but it is not going to help a child in any way.
At one, it's ironic actually. The one hand we say every child is different. you know
Actually,
every child has different needs. No two children from especially on the spectrum, we say no two children are the same. So if they're not same, why are we labeling? So if they're not same, why are they not same? Because their deficit areas could be different, their learning capacity could be different, their opportunities could be different. So all, if these are different, let us just focus on the strength and weak areas, the difficult areas, the deficit areas, and work on them.
Keep
Fine.
it basic, no?
Yes, but for documentation purpose, yes, I feel, because if the parent is moving from one clinic to another clinic, uh, clearly mentioning clearly mentioning the strength area and deficit areas, what you've been working on, and the provisional diagnosis.
Right.
Yes, I do that.
Okay. Is it appropriate to measure success by whether a child loses an autism diagnosis, or should we redefine what meaningful outcome look like?
I think we just discussed this. Meaningful outcomes are basically, is the child able to communicate better? Is he happier? Is he comfortable? Is he making initiative? Is he taking initiative in communicate? Is he taking interest? So all these things, all these are the questions we ask during assessment, isn't it, Nidhi? So
Right.
if you take any assessment tool, these are the questions we ask. So the
Yeah.
outcome should be pertaining to these questions only, no? So this is where I feel, we must, it's mirroring. So you start from this, and when you ask yourself, where have you reached? It's not the severity that reduces. I think it's much more than just reducing severity or coming out of autism. It's more about, is the child able to do what he was not able to do earlier?
I am getting into a little bit more deeper aspect of it is that we are discussing about children, but if we try to have a sneak peek inside our own life as an adult, how many times we ask to ourselves or to others, are you happy? We just ask, how are you doing? How much are you earning? Where have you been? How many vacations you have done? So what we are doing with ourselves, we are doing with the children too. We are
Being robotic.
measuring everything.
Yes, objectifying, trying to objectify everything and have yes and no answers to it.
We
you
are
know
measuring everything. Next one is again one of the trends which are coming up. If artificial intelligence becomes part of therapy, what should never change?
Human interaction should never change, will never change, and it can never take over. See, AI is here to help us.
Mm-hmm.
AI can analyze language samples. AI can support documentation, prepare presentations, generate ideas, and based on the child's needs, personalize activities. But
Right,
shifting child's mood, who can watch? The child wants to do it or doesn't want to do it, his willingness, who is there to analyze? So that's
right,
where the therapist is there. So the trust the therapist can generate, or it can the child can have that kind of trust, or with therapist, the comfort, the warmth, the human connection, yeah, I can never give the empathy, play,
right,
the essence. So the therapeutic relationships will always remain at the heart of intervention, the therapeutic relationship. So as I said, make AI your friend. Do not be scared of it. It is,
right,
especially in our field, speech language pathology, it can never replace speech therapist.
right. Because we are the ones who often say connection before correction. So connection is the part where speech therapist cannot be replaced by AI.
If you are truly connected,
Right,
I think it's important that, again, it's a different topic altogether. Are we truly connected? You look at somebody, can you actually feel into the child, the person's eyes? Can you actually see and feel how much of pain is there? That kind of thing, no, I don't think our AI can do. So, and the whole therapy, the whole, I think, essence, the whole spirit of therapy is that only. When you look at a parent, a mother, and you suddenly tell the parent that, we feel that these are deficit areas and the child may need therapy, you look into the mother's eyes, so much of pain and sadness and helplessness. You see?
Right.
So, yes.
If every therapist watched this interview, what would be your challenge to them to rethink or redefine about it?
I think we have kind of discussed this. I would ask every therapist one question. Are we treating a diagnosis, or are we treating a child, understanding a child? That's it.
That's a
Strength,
worthy one.
stories, opportunities. Are we understanding that?
Yeah.
So remember, if you're looking at a child, then you're not alone. You're not the only stakeholder here. So
Right.
collaborate. Collaboration is not optional anymore, Nidhi. It's compulsory. So future belongs to interdisciplinary practice. So when all the stakeholders come together and when children receive, consistent support across environments, so that's where we feel that the lasting change happens. So if I say I'm a SLP, I'm bringing change in child's life. Think, is it a real change? Is it a permanent change? Is it a change forever? Or is it just a transient change?
Right. That's you said very rightly because we need to work collaboratively. It's not a one person job that therapist will do this or parent will do this,
Yes.
parent will do this. That with that thought only actually I could build up this inclusion full circle framework. That was the thought behind only because all the stakeholders need to come to a common ground to facilitate the growth and development of a child. You cannot survive in fragmented systems or with different perspectives and confusing the child. And the last one is to bring inclusion full circle. What are three most important steps India as a nation must take ne- over the next decade? If you had to prioritize them, what would they be and why?
Okay, so if I had to prioritize three things, I would first work on changing mindset before
Of
change system, change mindsets of people. Now, those people could be of any level, could be
right,
grassroots level, could be people who are bureaucrats, could be who are those who are policymakers, so I think that collaboration should be such that the strategies should be made in such a manner that change of mindset happens at all the levels. Okay,
right.
the attitude changes. So
Mm-hmm,
inclusion begins the moment we stop asking, can this child fit here? Should we give admission to the child? No.
mm-hmm,
It starts when I ask, how do I ensure every child learns? That's
right,
it. So that should happen. And how do I ensure every child learns that policymaker? How do I ensure every child learns, who is implementing policy? How should I ensure every child learns teacher? How should I ensure my child learns parents? How should I ensure, I give therapy in such a way that whatever child learns gets transacted in the classroom. That's the therapist level. So I think mindset change is needed. Second, I would feel is these days you have inclusive school, but genuinely collaborative schools should be there. I mean, no single professional can create inclusion alone. Like I've been working for many years now in the field of inclusion, and I've tried to do my best, but I'm not alone. I see so many people who have been walking, and that's how the picture is changing. So the all the stakeholders, rehab professionals, everyone, we instead of working in isolation, work together. So that's why we can build collaborative schools. And it's important that SLPs become part of school system. So that's where I feel the third would be that make every professional who is contributing directly or indirectly to child's development,
Mhm.
not an optional part of a school system, a compulsory part of a school system, like
Right.
it is in West, you know.
Yeah.
That's what I feel. These three things, to, I mean, that would bring inclusion. It what brings inclusion full circle, basically.
Right. Right. And I'm hoping that we all are at least not, if not moving, at least thinking in that direction.
That itself is a progress. Even if we have started to think. I mean, you ask me 24 years back, uh, not many knew about the field that we are in. We have
Yes.
taken a long leap. So I'm sure next 2 decades, woof, we go the same way, and many, many more children will be benefited.
Right. And I'm hoping that to happen in ground, in reality, and in
It will.
practicality.
It will. It will. It will.
It was so encouraging and so empowering to interact with you, ma'am. You have enlightened so many aspects, and especially for my own sake, my takeaway is the shift in the thought process, how you actually put the questions, because how you define a question directly changes the answer. That's a key takeaway for myself, and surely I'll impart that knowledge to the parents related to me. So, thank you so much for being here.
My pleasure. Thanks again for inviting me. And all the all the viewers, whoever watches this video, it's very simple. Just one change, one shift, the way you think and you look at inclusion, and the whole perspective changes. So if not now, it'll be never. So do it now.
Right.
Today is the day.
Thank you, ma'am.
Pleasure.